right now in the US, there's close to about 140,000 people who are living with this disease. And every year, there's about 35,000 people being diagnosed and about 12,000 people dying of this disease. And yet, with all of that, when somebody gets diagnosed with myeloma, very frequently I hear it's not a disease they've ever heard of before, and it's a kind of a new one for the patient and for the loved one. So, over the last couple of decades, there's been such a great improvement in the outcome and the survival and things with multiple myeloma, and so many new options, new drugs that are being approved, so frequently. And so I think that if somebody gets diagnosed with myeloma, it's very important for them to know that all of this exists, so they can seek out a specialist in the care, so that they get the advantage of the most recent developments and things like that. And then the other aspect of it is the disparity in racially and things where Black Americans, for instance, have twice the incidence of myeloma, and yet their access to care and their ability to avail themselves of research trials, et cetera, is so much less than what it should be. So the outcomes are not as good. So again, awareness is something that would be really important to see if we can fix all of those gaps and disparities in care. So I hope that one day I can confidently say that we can cure myeloma to a patient who is newly diagnosed and trying to deal with the, with all the aspects of a new cancer diagnosis. There's so many areas where we need to make improvements. The new cutting edge therapies like CAR Ts and T-cell redirected therapies, immunotherapies, et cetera, have given a new lease of life for patients who really did not have any other good options. But yet, with all of that, we're not seeing a plateau in the survival curve, and we still have to have a long way to go to be able to really prove that still further. Then in terms of even preventing the development of myeloma from a precursor lesion, try to nip this in the bud before there's any onset of end organ damage. So I think there's a lot of room for all of these improvements. And right now, our current model for treating myeloma is we just keep treating patients until, indefinitely throughout much of their myeloma journey. But, to be able to refine our technologies to be able to detect minimal residual disease and use it to adapt our therapy so that patients who perhaps don't need continued therapy will be able to get off therapy. Long-term therapy has significant physical, emotional, financial consequences, and this is a real burden for patients and their caregivers. So there's a lot of room for improvement, and my hope is that, we'll be getting these areas soon. Getting hit with a new cancer diagnosis is always extremely traumatic. I think it's our job as clinicians and researchers to try to move this field forward so that patients are, that one day this is going to be like several other diseases that we have overcome and we have got a good cure for.